Welcome back, Focus Learners. I am absolutely thrilled to kick off Part 70 of our 100-part CPC exam series. In this explainer, we're diving straight into the literal bedrock of medical coding, the ICD-10 CM official guidelines. But hey, before we unlock these high-stakes exam secrets, make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, let's get right into it. Today, we're setting a real masterclass tone to help you conquer the first half of the ICD-10 CM official guidelines, ensuring you walk into test day with total confidence. So, here's our mental roadmap for today. Code structure, the two-step golden rule, conventions, excludes notes, instructional notes, and finally, placeholders and extensions. This structured breakdown is going to keep you right out of those common CPC traps. All right, starting with Section 1, Code Structure, the alphanumeric foundation. Listen, this structural knowledge is basically your armor against the exam. The way these codes are built isn't just arbitrary, it literally forces clinical precision. Every single valid ICD-10 CM code requires between 3 and 7 alphanumeric characters. And here's the absolute golden rule you have to remember. A code must be reported at the highest level of specificity available, no exceptions. If a more specific code exists, you just can't use a shorter, generalized one. So here's how this actually builds. Characters 1 through 3 give us the general category, which sits right before the decimal point. Then, characters 4 through 6 form the subcategory and subclassification. This is where you define things like location, severity, or the cause. And finally, that 7th character extension, that locks in those critical encounter details. Moving on to Section 2, the two-step golden rule, index to tabular. You might be wondering, how do we actually find these codes? You've got to use the SAFE workflow. Step 1, you always start by locating your main term in the alphabetic index. But wait, you do not stop there. Step 2, you must verify and finalize that code in the tabular list to catch any vital instructional notes. It's a two-step dance every single time. Now pay close attention, because I need to highlight a massive CPC exam trap right here. Never code directly from the alphabetic index. Seriously. Doing this is the fastest way to fail questions, because you are going to completely miss mandatory exclusions, required 7th characters, and sequencing rules. Always, always, always check the tabular. Okay, Section 3, Essential Conventions, where punctuation matters. In this manual, punctuation isn't just grammar, it's a set of strict legal functions. Parentheses, they enclose non-essential modifiers, meaning they don't change your code assignment at all. Brackets, on the other hand, enclose synonyms in the tabular list, or they identify mandatory manifestation codes over in the index. And a colon? Well, that just means the term is incomplete and requires an additional modifier to actually be assignable. Next up, Section 4, excludes notes, the masterclass. These are easily the most highly tested and, honestly, the most frequently confused notes on the CPC exam. The absolutely crucial point here is understanding the difference. Excludes one literally means not coded here. It's a strict, pure exclusion. The conditions are mutually exclusive. Think of a congenital versus an acquired condition. They just cannot be coded together. Excludes 2, however, means not included here. In this case, the conditions might actually coexist, meaning you totally can report both codes if the provider documented both. Let's hit Section 5, Instructional Notes and Sequencing Guidelines. All right. Let's step into the rules that govern the mandatory order of codes. When you see code first or use additional code, you're looking at the etiology and manifestation convention. The underlying cause, the etiology, is always your primary code. Also, if you see the words with or due to, the guidelines legally presume a causal link between those conditions, unless the doctor explicitly writes otherwise. And definitely keep an eye out for those slanted brackets in the index. They're pointing out your secondary manifestation codes. You are definitely going to see NEC and NOS on the exam. Think of NEC, or not elsewhere classified, as a code set limitation. Basically, the doctor gave you great specific details, but the ICD-10 book just doesn't have a specific code for it. NOS, or not otherwise specified, is a documentation limitation. That just means the doctor's note simply lacks the clinical detail you need to get specific. Bringing us to Section 6, Placeholders and Extensions, or as I call it, the X factor. This next structural rule is absolutely vital, especially for the injury, trauma, and obstetrics chapters. If a code category requires a 7th character, it must be in the 7th position, period, no exceptions. If your base code is only 4 or 5 characters long, you have to use the dummy placeholder X to fill those empty spaces, which pushes that 7th character exactly where it belongs. So what exactly are those 7th characters? The big 3 you'll see are A, D, and S. A stands for initial encounter. But watch out, here's the trap. It means the patient is receiving active treatment, not just chronologically seeing a doctor for the very first time. D is for subsequent encounter, which is for your routine healing and aftercare. And finally, S is for sequela, which is basically a late effect of an injury.
And finally, our outro, the Part 70 summary cheat sheet. We've covered some incredibly high-yield ground today. Let's wrap up this masterclass with a quick review.
So here's your Part 70 cheat sheet. Definitely grab a screenshot of this for your study sessions. Remember your workflow. Index first, verify, and tabular. Excludes 1 means mutually exclusive, so you just pick one. Excludes 2 means you may code both if documented. And always use that X placeholder to secure your 7th character position.
So what does this all mean for our next explainer? Well, now that you know the foundation, how do these rules shift when a patient is pregnant or when you're dealing with complex neoplasms? You absolutely won't want to miss Part 71, where we tackle those exact chapter-specific guidelines. Practice that workflow, and as always, keep coding.